Very good morning, and thank you so much for joining in on today's webinar on mental health and staying positive. So before we get into the webinar, I think let's start with a small introduction. My name is Immanuel, and I'm based out of the Middle East in Bahrain, and I do a lot of webinars. And I'm an HR person. I do a lot of shows for people, for empowering people, and all of that. But today this is not about me. This is more about Dr. Nikita and what she has to share with us. I'm going to introduce Dr. Nikita first by myself, because Dr. Nikita is someone I know very personally for the last 1.5 years. And she's one of the best psychiatrists that I've ever met in India. And I'm not saying that because I know her, or I'm not trying to market Dr. Nikita, but she's genuinely a very, very approachable person in every way. So that's pretty much about knowing her personally. But academically, Dr. Nikita has finished her MBBS in Maharashtra University. She's done her DNB Psychiatry from National Board of Examinations in Bombay again. She's got over a decade of experience in working as a psychiatrist, and she consults in various hospitals in Mumbai, in India. And the best part about Dr. Nikita is she's the only doctor I know who does virtual sessions for a lot of her patients. So Dr. Nikita, I would be a little, I don't want to introduce you the wrong way. So if you could tell us a little bit about from where you come and the kind of accomplishments that you've had, and the credentials that we look forward to as we speak to you this morning.
Right. So thank you, Immanuel, for asking me to do this webinar. It's something that's very close to my heart. And I do think that when we do our MBBS, psychiatry is something that is given a very small bit of mind space. And I do think it was something that was very, very interesting to me. And I think as we go on, there is a lot of stigma, there's a lot of lack of clarity and awareness when it comes to mental health and mental health disorders. So that is the reason why this is something that I really enjoy doing, interacting with people that don't usually fall under the ambit of what we practice, And the other thing that I really like is how the things that we don't know is that even talking to a trained professional and changing the way you see certain events cause actual physical changes in your brain. So psychotherapy is almost as important as pharmacotherapy. In certain cases, it can replace pharmacotherapy. Of course, in certain things, you do need medication. But this is the basis of my practice, to get a nice balance between medication and psychotherapy, so that the patient can have long-term wellness.
Right. Thank you so much. I think some of them are messaging and saying we're not audible. I don't understand. Guys, can you tell us if we're audible? Because there have been at least 3 or 4 people who are saying we're not audible. Can you just give us a thumbs up if we're audible, please? All right. Okay, I think we are. Okay, I think some of you, if your network is not very strong, you please change into Wi-Fi or do something where you can get a better network, because, or you can switch off your videos to hear us better. That's when that's a little bit of a challenge. Sorry, doctor.
No worries.
Okay, so doctor, why don't we start about just talking about the term mental health? Because just like you said, there is a lot of perceptions, or rather misconceptions about what this term actually means, and all of that. So before we talk about a lot of things, I think it's very important for everyone to understand what mental health is all about. Is it something that always pertains to a disease or something like a disorder? Why is it always looked at it from a very, very negative perspective? Because when you say physical health, people don't really think a lot. But when you say mental health, they're like, mental.
Yes, suddenly it's something scary. Yeah.
Yes. So what is mental health all about, and why do we need to understand this in a larger scope of things?
All right. So that's an excellent place to start, because what happens is that we're working with an evolving definition of mental health. When I studied psychiatry, we were moving from a place of mental health is just the absence of mental health disorder to the current diagnosis, current definition that the World Health Organization gives us. And that's basically a state of well-being in which an individual can realize his or her own abilities, they can cope with the stressors of life, they can work productively, and are able to make a contribution to society. So, this concept of well being is something that they've introduced in the last, let's say, 15 years. Of course, it doesn't come with its own, it comes with its own problems. Emotional well being means like happiness, interest in life, then there is psychological well being, which is like being able to like who you are as a person and parts of your personality, and being able to make connections with people. And of course, then there is also the functional well-being. All right. But a lot of doctors now have taken opposition to this concept of well-being because it stresses on this positivity. Sometimes people come to me and say, I don't feel happy, I don't feel positive. So, and also, of course, it comes from a very specific social and functional standpoint, which is perhaps more leaning towards the North American definitions of what well-being are. So now we're moving towards this concept that it's not a perpetual, like I'm always happy, I never have a trouble in my life. We're moving to this concept of this dynamic equilibrium. That means that you're able to maintain a kind of harmony, ability to use this, okay, to use your ability to think, your social skills, your awareness of your emotions, and use that to be flexible and adaptive to cope with adverse life events. And that's what we're coming to the concept of mental health, which is why we chose this particular concept to talk about in this session. So we're looking at mental health as not this one static, like I'm good all the time, but this very dynamic way of coping adaptively.
Right. So if I were to ask you, how would you rate the importance of mental health versus physical,
Okay.
which is something that's an ignored topic?
Yeah.
What would you want to tell people about it?
Right. So the main thing that one has to know, and this is something that we stress about over and over, there is no health without mental health. Okay. This is something that is ignored by a lot of people, because even right now, when I have to speak to people about why don't you get help for your mental health problems, I have to anchor it in how it affects their physical health. Because somehow, because we can view different parts of our bodies as parts of our bodies. So if I have a problem with my knees, it's a problem with my knees, not a problem with me, right? But your mind and your brain are both part of the same organ, right? So like when you go to a neurologist, okay, and he says, oh, you have a problem with your brain, you're still okay with it. But mental health is considered a problem with your mind, which is a part of who you are. So it's difficult to not see it as something that's wrong with you, right?
Right.
Which is where the stigma and the hesitance originates. But the reason why it's important, why it's such a big part of your health per se, is that when you don't cope with stress, everything that we do is a stress, right? Like even exercise is a stress. Going to work is a stress. Navigating traffic is a stress. Any change from equilibrium is a stress. And if we don't cope with it adaptively, there are certain physical and chemical changes that get set off in your body, okay? Which actually cause physical harm to your body. So what we've been noticing is people with chronic anxiety, people with depression actually have shrinking of the brain. Your brain is unable to repair itself. It's unable to kind of allow, what is the word for it? When you exercise, you talk to people, you do things that you enjoy, even in your adult life, your brain produces new nerves. It repairs the things that are getting harmed. All this stops when you're in a state of stress. And this is just talking about the brain changes. When we talk about the changes that happen in your body, right? All of us are aware of like the feeling that we have before an exam or before an interview, just like, you know, the flutters in your stomach, the palpitations in your chest, you know, just the shaking, all of that. That is something that we can deal with, you know, but when it goes into a chronic thing, right? Your body thinks that it always has to be ready for a fight. It starts pushing up your sugar levels just to be ready for that energy. You start developing insulin insensitivity. That's how you walk into diabetes, you walk into heart ailments, you walk into lower immunity states. So it creates like this cascading effect in your body as well. And which is why you cannot be healthy, right? Even if you do studies in people who have long-term terminal ailments like cancer, we see how good mental coping actually changes the trajectory of that physical disorder. So you have to know that your mind cannot work without the body, but the body definitely cannot work without the mind, which is why mental health becomes important.
Right. It's interesting how you said this stigma is always attached to mental health. But do you think it's cultural? I mean, do you think there's some part of the social fabric and the society and the people around us that have actually stigmatized this more than it looks like, or it shouldn't even be stigmatized for that matter. So how did this happen? Why are we not stigmatized about physical health, but why do mental health in a different way?
Right. So there are several studies about stigma, but if I have to just talk about it really like in a very easy way to understand, the three things is, one, as I said, it's a part of who you are. The second thing is the kind of language we use to describe people with mental health disorders. Like in India, it's so common to say, ye pagal hai, tum mental hai. I was just watching people who are discussing people who have, let's say, an opinion different from you, not even a mental health disorder. And they say, you need to go to a psych ward. You know, it's like, we used to have in Bombay, we say, Alibag se bhag ke aaya, Thane se bhag ke aaya. So how the way, and like, let's say if someone has a problem, like an alcohol dependence problem, we'll call them alcoholic. If someone has schizophrenia, you'll call them schizophrenic. That becomes the one big describing factor for that person. You don't say a person with an alcohol problem, right? And that is something that also adds to it. And it comes from the fact that a lot of my patients say that when they talk to their family or they talk to their well-wishers, they'll say, it's in your head. Snap out of it. Like, you know, your depression's in your head, your anxiety's in your head. Like, you know, it's just kind of like, it basically smacks of weakness or poor self-control, something that you aren't able to, like you should be able to deal with and you can't, you know? And that's where it comes from. Like when you talk to, like, let's talk about like diabetes. You won't say like you're weak, that's why you have diabetes, you know? He'll say, okay, your body is not processing sugar well. You know, but you won't say that, oh, I am not being able to adapt to this certain life situation, or I don't like myself enough, or, you know, I am not able to see my achievements. I'm only looking at the things that I lack. We're not able to point it down to a specific problem that we're having with coping. We just see that as who we are. So that's the second problem. And the third problem is just a lack of understanding of the spectrum of mental health ailments. So for example, if you go to your family physician, you might go for a cold, you might go for like hypertension, you might go for like, let's say just like poor immunity, but somehow everyone who goes to a psychiatrist is crazy, is mental, you know? So they don't understand you can go to a psychiatrist for like a bunch of different things, ranging from severe mental health ailments to like common anxiety. Anxiety is like almost there. And I think like WHO had come up with a really nice slogan in the early 2000s, like 1 in 4. That's how common it is. 1 in 4 people have a mental health ailment. You know?
But doctor, I've also read and I've also told, and I also tell people that a certain level of an anxiety or a certain level of a stress is natural in your body. I mean, it's a defense mechanism. That's how we're built. When do we know that this is a shift from it's not normal anymore to going to, okay, it's are there any symptoms that we can talk during anxiety?
So of course we have different mental health disorders, right? So all of us have specific genetic predispositions all of us have personality predispositions.
Right.
So we all decompensate. Decompensate is a word that means when you're under stress, your usual like coping habits is something that we call a decompensation. So we decompensate with what our predispositions do. Okay, and sometimes this is for a short time. Okay,
Right.
sometimes it is commensurate with the stress. So for example, if I'm starting a new job, okay,
Right.
if I'm an anxious person, I will be anxious for the first 2-3 weeks, and that's fine. Okay, that's how I decompensate. All right, but if it is disproportionate to the problem, if it is just continues beyond certain normative curves, okay,
Right.
the third thing is if it starts spreading in every aspect. Like let's say I'm anxious at work, but I come
Right.
home and I can switch off.
Okay.
Okay.
All right.
So it is now spreading into your everyday activities.
Okay.
And the fourth thing is now it starts affecting your work or whatever you are doing. Like you're studying, you're working disproportionately. That's when we know that we need to seek help. So stretching longer, being disproportionate,
Okay.
okay, affecting everyday activities and
Right.
affecting functioning. That's when we
Right. And what are the physical symptoms, doctor? Because we also spoke about the mind being connected to the body. So what kind of physical symptoms do you experience when that power shift happens?
Right. And that's a very good question, because I know that when we used to work as an MBBS doctor,
Right.
we, as a doctor, you could tell that these physical symptoms are
Right.
actually linked to your mind. So that, like, not to say that, oh, you know, so there was this term called psychosomatic that was used for a brief period of time.
Right.
But now we're using the term functional overlay. Functional overlay
Right.
meaning that your mental health is affecting the manifestation of your physical symptoms. So for
Right.
example, in anxiety, you might be having recurrent like band-like headaches.
Okay.
You know, you could be having tension or body aches. So just like some people would just come with like a chronic backache, which is unexplained, like everything is fine in the investigations. Some people could just be coming with fatigue.
Okay.
The number of people that present with GI symptoms like acidity and irritable bowel, these are
Right.
all linked to stress
Right.
mechanisms, right?
Right.
Just poor immunity could be coming with,
Okay.
you know, stress mechanisms. And in depression, of course, we have like, you know, markers like disturbed sleep, unexplained weight loss. You could be having a poor appetite, putting on weight for no reason, losing weight for no reason, like not trying anything, not changing anything, and just
Right.
so these are some of your stress markers that you would see.
And is it necessary that anxiety and depression always go in hand, or could one supersede the other?
Right. So psychiatry and psychology are nascent sciences. So we still don't have biomarkers, because what we might be seeing as depression could actually be different disorders with a similar manifestation.
Right.
Okay. So what we follow is something called a hierarchy. So certain things will supersede other disorders. So for example, physical, like let's say if you have a brain lesion and you manifest with depression, we would say this depression is likely to be because of your brain lesion.
Okay.
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 But let's say if you have an alcohol problem and you manifest with depression, we'll say that this depression could be secondary to your alcohol problem. So physical things would supersede. Similarly, depression supersedes anxiety. So people who have an anxious personality may manifest with depression, okay? But the anxiety then is considered part of the depression. But let's say you are just plain anxious, no depressive symptoms, then your diagnosis becomes anxiety.
Okay. And it's important how we started our conversation to say words are so important, and the kind of conversations we make are so important to actually ensure that this taboo does not exist. But on the flip side, I see a lot of people saying, oh, I'm depressed.
Yes.
It's kind of now becoming a loosely used word as well. So when do we know it's a regular sadness because something happened into as opposed to this is depression? So is there a difference between the regular sadness you experience because something bad happened, you had a bad day, as opposed to saying the loss of a loved one, a prolonged 6 months sadness? How do we differentiate between the two?
Right. So this is actually something that we, like in lay parlance, say garden variety sadness and a clinical depression. Okay.
Right.
So within sadness, as I said, it will be commiserate. Okay. So we also have certain other disorders that we use. So there's something called an adjustment disorder. So you see that there's a trigger.
Right.
And then the person decompensates.
Okay.
So that's when you say it's an adjustment disorder. So they could decompensate with depression, decompensate with anxiety. But for your specific question, right? How do we know that this is garden variety sadness and this is depression? I had a breakup. I failed an exam. I am not getting a job. That would cause sadness. So the thing is, we have specific clinical syndromic diagnosis. Okay, so this has to be pervasive and persistent for more than two weeks. Okay. And then you have to have a presence of at least 2 of 3 symptoms. So that is persistent sadness or low mood. Okay. Reduced energy or fatigability, easy fatigability. So the things you could do earlier just kind of like seem like a drag. You have to push yourself to do it.
Right.
Okay. And the third thing is not enjoying the things you used to enjoy before. Okay. So like, let's say that you could kick back or meet your friends, watch something on TV, listen to some music, and it would make you feel better. But now even those things don't make you feel good anymore. Okay. So presence of 2 of these would, for more than 2 weeks,
right,
for almost all the time,
right,
would then say that you're heading into a clinical depression. Of course, you have ancillary symptoms like guilt.
Right.
Okay. You could have pessimism, like nothing is ever going to get better. And you might feel like that for a day or two, even normally. But this is just continuous. You just can't snap out of it. So people who say like, why can't you just snap out of it? Why can't you just see this is not going to happen? They can't see it. It's kind of like dark glasses.
Right.
Everything looks black. It's kind of like that.
Right. Yeah. Right. And another important thing is terminologies. Is there a difference between psychology and psychiatry?
Right. So psychology is basically the study of the human behavior, thinking, and then clinical psychology is the application of that. Psychiatry is more based on a medical understanding of the same things, right? So of course, psychology is a part of psychiatry. One cannot exist, cannot be a psychiatrist without understanding psychology, right? But psychiatry is more like the medicalization of it in a sense. So you're trying to understand the biological mechanisms of that, the genetic mechanisms of that, the neuroendocrine system, how that is affected by that. So perhaps the difference would be the approach that is taken by the psychiatrist and psychologist. And perhaps if it's a very severe disorder, like let's say something like schizophrenia or severe depression, or like let's say an anxiety disorder that's not responding to psychotherapy, then you might need medication, and that's where the psychiatrist would come in. That's something a psychologist cannot do. Psychiatrist can do.
And what I've also understood from our conversation is the fact that your mental health is largely dependent on your biological or physiological orders or disorders as well, right? And I see these two as completely 2 different compartments. And they don't connect the fact that my mind is not all right because my body, there's a problem in my body as well. So what are the factors in the body that decides the state of the mind, doctor, from a layman's perspective?
Okay. So this is, of course, an oversimplification. All right. We do understand that there are certain genetic things, and these are studies that people are really stressing on right now. And we've not been able to get very clear, like, how in, like, let's say in tuberculosis, you'd be like, this bacteria causes tuberculosis. So the kind of mechanism that we're looking at is more like the ones that we use for lifestyle disorders. So something that you use for heart ailments, diabetes, hypertension, to use a technical term, it's called a stress diathesis. Okay, so some people could be having very low genetic predisposition for it. Some people could have high genetic predisposition. That means someone in their family or several people in their family have had history of mental health disorders. So that would already make me more likely to develop it. Okay.
So which means mental health is also largely genetic?
It could be. It depends on the disorder. So there are certain disorders that are almost largely genetic, like schizophrenia, alcohol dependence, severe depressions, bipolar disorder. These are largely genetic. And the way we come to know this is twin studies and nature versus nurture study. So that means that if you see people in the family will have a higher risk. So if you have a parent, you will have a higher risk. It doesn't matter whether it's you're adopted later. Your genetic thing, so nature becomes more important than nurture in those disorders. Okay, but even in this, there are modifications, right?
Okay.
So if you modify, like, why is it that if you have twins, both the twins don't develop schizophrenia, or both the twins don't develop alcohol dependence?
Right.
So it's not like, it's not like this fatalistic, oh, I have the genes for it, so now I'll develop schizophrenia. There's nothing I can do about it. There are things you can do. And these are the things that I actually wanted to, like, the resilience part is going to come to that. So I'll leave it for then. But as I was saying, genetic predispositions, and then of course, the stress cascading mechanisms. So if my genetic predisposition is low, okay, I can go through very, very highly stressful conditions and perhaps not develop a psychiatric ailment.
Okay.
But if I have like a high risk, then I might decompensate with even smaller stressors.
Okay. And I just want to understand how could you break the word predisposition for us? Because I think it's a slightly jargon to me, but not to me. For a lot of people, they might not understand how we use this word in the context of psychiatry.
Okay. So by predisposition, I mean so when you go to a psychiatrist, they might ask you, does anyone in your family have a psychiatric disorder? Okay. That is the easiest way to understand predisposition.
Right.
Is that if in my family, there are several people who have depression. Okay. Or if in my family someone has had schizophrenia, or if all the male members in my family have an alcohol problem, okay, then I am likely to have a psychiatric ailment. These are all markers for me having the genetic likeliness. Maybe likelihood is an easier way to understand
that. Right. And it's interesting how you've been mentioning alcohol as a continuous problem in terms of addiction. So I mean, we have a lot of young people today in our audience. I mean, over about 100 odd people today are in the age groups of about 20 to 25 in our audience today. And one of the things that I find is young people are more prone to anything that is interesting and fascinating. And then that becomes a habit, and then it becomes an addiction to some extent.
Yes.
What do you think about, what would be your advice for this kind of an age group? In particularly in terms of when you say an alcohol or a substance abuse, or could be, I mean, people think it's just fun at one point, or even smoking for that matter. So anything that harms the physical thing. How do we talk about these things? Are these issues more prevalent in the society today, or how do we tackle these issues, Doctor?
Yes, right. So because we're speaking in a very general way right now, I see in the questions a lot of people are asking specific things. So please understand that this is very, very general. Okay.
Right.
So the reason why I mention alcohol so much is because compared to the other substance use things, it's something that's very acceptable. Okay. If you see media, like there was this time when we used to have, these listings in the newspaper about what to do today. Like, what are the fun things you can do today? And the number of happy hour listings that used to be there. So it's like, even when we watch shows, like I know a lot of my patients would be like, I saw this show and I would think like working would be that you go to work and then you go to the bar, like down the road, and all of us hang out together. So it's considered a normal part of relaxation, which is why I mention alcohol so much. But what people don't understand is the devastation that it can cause when it becomes a dependence. Okay. Alcohol is one of, in my practice, one of the most devastating ailments I have seen, because people actually encourage alcohol use earlier, but then the minute you become dependent, it's your problem. You don't have good self-control.
Right.
Okay.
Right.
So the reason why in adolescence it's important is you have to understand adolescence and early adulthood is a very important time for interventions. This is the time when your brain is the most vulnerable.
Right.
Okay. When you're in your adolescence and early adulthood, your brain is undergoing drastic changes. So it's in this concept of optimization. So it's cutting out entire neuronal pathways that it deems unuseful. It just wants to become optimized. It wants to become efficient. So the habits that you pick up at this time are the circuits that your brain are likely to remember. Okay. So although like smoking a cigarette, or like right now, increasingly cannabis use, because there's a huge pro-cannabis lobby that's happening in North America. Okay. Right? So there's a lot of information about how this is such a wonderful thing. Cannabis, I smoke it, I feel relaxed. I drink there's this information that a glass of red wine is excellent for your health. So there's a lot of pro alcohol and pro cannabis. Luckily, no pro nicotine data that's coming out. Okay, but these fall under coping mechanisms that work in the short run, but could be devastating in the long run. So we want to have coping mechanisms that actually help us in the long run. What people don't understand is not everyone who starts drinking develops alcohol dependence. So
Absolutely.
So the thing is that you could be like, everyone's drinking 3-4 pegs when we go out on Friday night. So why should I be careful? But if you have family history of alcohol dependence, you will develop alcohol dependence. The thing is, no matter how socially prevalent alcohol is, so there could be countries where alcohol is forbidden, and there could be countries where everyone drinks. The percentage of alcohol dependence in that, the prevalence is roughly the same. 10% of the population will have alcohol dependence. That's how genetic or biological it is. Okay, so you have to be cognizant of what works for you and what doesn't. That's the thing.
And what are the after effects? I mean, would you say an alcohol dependence is a little better than a drug abuse or something like that, or are they all in the same scale of addictions? Or
so the common pathway, the neuronal pathways, in terms of the reward mechanisms, in terms of the procedural memory part, that remains the same. But depending on what substance it is, physical withdrawal becomes an important thing. So alcohol has a devastating physical withdrawal thing. So even if I want to stop, I won't be able to. Similar with opioids. Okay, opioids, that means you'll develop dependence like this. The most physically dependent substance, of course, is cigarettes. And then after that is coffee. So, all of us is just like,
guilty as charged, I guess.
So the thing is, depending on how physically addictive the substance is, that means how bad will my withdrawal be? Okay, that would decide your ability to kind of give it up. And the reason why cannabis is not so devastating in the short run is you don't develop a huge physical dependence to it. But then, let's say if I have a predisposition to psychotic disorders in my family, and I start smoking cannabis, I will be more likely to develop schizophrenia. So that is where that genetic and environment interaction becomes important in the pathways to developing mental health disorders.
All right.
So if I have family history of depression and I start drinking alcohol every day, I would be more likely to develop depression.
But doctor, how do you deal with peer pressure? Because smoking, when I grew up, they used to say smoking is a peer pressure. You feel the habits because of that. Then eventually alcohol became, a peer pressure thing. Now I see, drug abuse is something in school. We used to have topics about debating on drug abuse. But now it's becoming a thing of something that you do as a matter of pleasure. And, oh no, it's okay, you can take this. This is not all right, and things like that. But it's, in my opinion, it's just not okay to have anything that is abused. So how do we cope with peer pressure, one? And is there a way that when you are, when something is induced to you, how do you say, okay, I don't think this is right? I mean, is it coming from a moral code of ethics, or is it because, is it to take care of your body and your mind? How do you face these things, doctor?
Right. So peer pressure is something that becomes very relevant in this adolescent age group.
Right.
Because, if you study different theories of psychology, there's one that at this age, you're individuating. So you're developing who you are aside from your family. Okay. So you're trying to develop your own personal ethics and your own personal moral codes. And that comes from developing a sense of belonging to your peers. Okay, so this becomes a very important part. You want to belong. Okay, and usually that importance of belonging would come from your confidence levels. So let's say that I can belong, but I can draw a line. I can be like, okay, I belong, but I don't have to become them.
Okay.
Okay. And this is a thing that we have to work on the whole time. So actually smoking and alcohol also has like that cool factor. Like, the cool, like the guy standing in the corner who doesn't give a crap about the world. He's the guy who's going to be like smoking or drinking and things like that, right? So when you realize that you can have certain strengths or uniqueness that doesn't come from doing what other people are doing. So when you can focus on that, you can develop like a healthy sense of belonging, but individuating as well. That tightrope walk is what is important.
So you should know where to stop. That's basically what I'm.
That is basically what I'm trying to say. Yeah.
Right. And the other thing is, doctor, how do what is? I mean, I'm going to get into a little bit of demographics here, because are there particular genders that are that, between male and female genders? Are they both prone to addictions and substance abuse, or is there a particular way, or is there a particular age?
That,
yes.
I see that someone else also spoke about, like, genetic cases and the ages. Right. And this is like, we see this in disorders across the board. Like, so whether you're talking about cancer, whether you're talking about diabetes, okay, depending on what causes the disorder, it manifests at different ages. Right. Okay. So like, let's say schizophrenia, we've not spoken about it because it's a serious mental health disorder. Okay. Right. That would usually manifest at this time when your brain is going through like this chopping off the neurons process. So you mostly see it in males for some strange reason at the age group of like 17 to like, let's say 24. Right. Okay. Similarly, as you were talking about substance use, we sometimes use that as a marker of depression. So there is something in social conditioning about how different genders are allowed to express emotions. Right. Okay. So as a woman, I can't be aggressive. Yes. Okay. If I get angry, I can't go tell someone off. Right. Okay. So I'm supposed to, so most women, for some reason, and of course this is a generalization, please don't take this the wrong way. Okay. Women tend to be internalizers. So if I'm going through a hard time, I'll take it out on myself. I'll manifest with anxiety and depression. Right. If I'm a guy and I cry, I'm weak. Yes. Don't be so girly.
Exactly.
Okay?
Exactly.
So, all right. So they are supposed to manifest their emotions aggressively and in an external way. Right. So they might act out. Okay. So they might break things. They might beat people up. Right. Okay. Or they might start consuming substances, because that is okay. That is a healthy way to show you're upset. So if you, like, your classic thing is Devdas, right? I have a breakup. It's okay for me to drink. Like, someone's really made that comment, like, smoke weed and fly high, right? So somehow, if I'm a girl and I smoke, there is still that level of taboo associated with it.
Yes.
But for a guy, it's like, oh, he had a breakup, he's drinking. It's acceptable. So,
but that goes for everything in our society in patriarchy, right? I mean, whether it's dressing, or whether it's smoking and drinking, or whether it's about socializing, we've tagged people into how people should be
boxes.
And we've put them into boxes. And like you said, it is so important for people to understand that a man should be able to express himself as well, because many times often been told that if you're a man, you're not supposed to cry, you're not supposed to be so expressive and emotional and things like that.
And if you're a girl, you're not allowed to get angry or like shout at people or like it's basically that. Kabir Singh is like the best example of glorifying this one person has commented, of glorifying this stupid patriarchal mindset. But that's why we see substance use disorders more commonly in men than we see them in women. Because perhaps a lot of women, even if they have an alcohol problem, might not come for help because it is so socially unacceptable, but also because this is considered a normal coping for men as compared to something like a depression.
Right. So, and also, unfortunately, this questions come up because I see a lot of people saying, it's okay, he's only smoking weed. I mean, from smoking cannabis or, an overdose of nicotine. I mean, is a small amount of weed okay, doctor? I mean, how?
Okay, so
because it's very common in India. I've seen this very common in India. So
that's because cannabis is something that has been part of our cultural, like bhang is considered a part of our cultural thing. So it's not as like, when you see people smoking heroin, you'd be like, that's a bad guy. stay away from him. But but consuming cannabis has become like very, very common. And the thing is, I would be very wary to say like anti-cannabis or pro-cannabis, right? But the thing is, you have to understand your body. Okay, like someone said, someone can drink like 2 pegs of alcohol every day and never become alcohol dependent. Okay, and someone can drink like alcohol for 1 year and become alcohol dependent. Okay, it doesn't matter how much you drink. It doesn't matter how long you drink. It doesn't matter how well you I don't get drunk. I drink alcohol. I never get drunk. I smoke weed. I never get high. I can do my everyday stuff. That's not what's important. It is, can your body handle it? There are some people who smoke weed once, get paranoid thoughts. That's your clue. Your body can't handle it. If you do this every day, you will become psychotic. You will develop an amotivation syndrome. You will not be able to work. So for some people, it can be like this harmless thing. They smoke once in a while. They never get hooked to it.
Right.
Okay. And for some people, it becomes something that devastates their mental health. So it's really about your body is telling you all the time, listen to it.
Right. And interesting, somebody mentioned about social media addiction. Where does that fall in all of these addictions that we're talking about?
It is the same. It's the same pathway. It's actually the same pathway, right? It takes over. Let me just explain what addiction is first. So I think that because that's what's happening. What's like the same thing like a garden variety sadness versus a depression. And a garden variety substance abuse or substance use, forget abuse, substance use versus dependence. So as I was saying, certain things you can get dependent on easily because the physical withdrawal is so high. Okay. So that's your, let's say your cigarettes, your opioids. I don't think anyone can just be a cigarette user. You will be dependent. Okay. No one can just be an opioid user. You will get dependent on. Okay. But in other things, you have to have 3 of 6 of these criteria over a period of a year to classify as dependence. We're trying not to use the word addiction anymore because it's become like negatively pejorative now. So we use the word dependent. It'll be in a while, dependence will become pejorative. We'll start using another term. Okay. But the thing is that you have to have craving. That means that you're like, like your brain is constantly thinking like, where am I going to get like my next walk? What am I going to get like my next drink? Okay, so that craving, I need it. That's the first thing. The second thing is tolerance. That means if you consume the same amount, you don't get the same high anymore, or you need more and more amounts of it to get to feel the same. Okay, so that's called tolerance. The third is withdrawal, and each substance has its own individual withdrawal syndrome. So everyone knows like a coffee withdrawal, like headaches, irritability, just like can't function. The cigarette withdrawal is very similar, but add a shaking to it. Okay. Alcohol is also initially mild, but the reason alcohol is problematic is what people don't know is the alcohol withdrawal can be fatal. So if you see a lot of these celebrities died when they quit alcohol, that's because they probably had a fatal withdrawal. Okay, so you can get seizures in alcohol withdrawal. You can have hallucinations that are so real. I have had patients who have like basically jumped out of windows in the period of alcohol withdrawal. Okay, like they have no idea where they are. They have no idea. I was working in a naval hospital. I had these old naval officers who thought they were on a ship. They were running around in the ward, like shouting all hands on deck. Like they didn't know they were in a hospital anymore. So that's how devastating an alcohol withdrawal is. So withdrawal is the third thing. The fourth thing, of course, is an inability to control intake. So if you've decided, I don't want to drink today, okay, or you've decided I have only 1 peg, okay, but you still consume as much as you used to. Like it just goes back to that stereotypical habit. That's the fourth. The fifth is it takes over your other activities and interests. Okay, so like let's say that like you're not able to work anymore, or like let's say you were a sports person, but now you're only interested in doing the drug. Okay, and the last thing is knowing that it's bad for you and not being able to stop. Okay, so if you have 3 of these 6, that's when we say you have dependence. And then now, that's when the genetic predisposition and your environmental factors and all of that come into play.
Okay. Since you mentioned celebrities and all of,
Mm,
with the current climate of what's happening, I'm going to channelize our discussion towards,
mm,
again, kind of mentally feeling low and what really causes people into, taking their life out. Or when do you know that these feelings are not all right, or it's okay, or it's not okay? At what instances, proportions that you feel this way? And when do we know we need to have help? I mean, it's
right.
very important, right? It's one is the global climate of how everybody
Yeah.
psychologically right now, because
Yes.
people you can't see, there are people dying out there, and it's all playing a role in your mind. And then this is a trigger for you to probably say, okay, I don't think this, I can handle this.
Yeah.
And with what's happened in India recently, and there have been subsequent people wanting to take their life off because they think that's a more of a viable solution
Yes. Yes.
in life.
Yes.
So, doctor, two things I want to ask you is, one is it normal to have these feelings at some point in your life? And
Okay.
do you know you need to seek help when these feelings are, consistently
Okay.
doing with
Right. Right. So I'm going to talk about the thoughts that lead to suicide first. Then we'll
you?
talk
Right.
about the risk factors of it.
Right.
Okay. And then
Right.
we'll talk about when to seek help.
Okay.
Okay. So the thoughts, so normally suicide is like a spectrum-like behavior. Okay.
Okay.
So it initially starts with a bleak outlook. Okay.
Okay.
So the first pattern is pessimism.
Mhm.
Okay. So when you think that my life as it is right now is terrible
Okay.
and there is no chance it's going to get better.
Okay.
Okay. A lot of my patients come and tell me, what's the point of then living? So this is a very common thought that a lot of people have. What's the point of living?
Right.
Okay. So that could be it's quite common. A lot of us have it in passing. I wouldn't say that's a suicidal thought. Okay.
Okay.
That's just pessimism. Okay. When this starts getting aggravated, okay, they'd be like, it moves from what's the point of living to I would rather be dead.
Now that's
Okay. That's that transition where things start getting tricky.
right.
From what's the point of being alive to it's better if I was dead.
Okay.
Okay. Then it moves to what are the things that I can do to kill myself. That's when you know trouble.
Okay.
Trouble has started. Okay. And thereafter it goes to preparing for that. That is when all of us have to be careful and be like, oh my God, probably this person needs to be moved to a safe place. These are the only times when we recommend psychiatric admission, actually. Okay, because when you are in that frame of mind, even when we start treatment, it might increase the risk of suicide.
Right.
Okay, so we have to understand that this is the journey that people go to. Depending on what ailment you have, that journey can be quick.
Okay.
Or it might not progress at all.
Right.
Okay, so like let's say I have a personality disorder that tends to make me be pessimistic, like all the time.
Okay.
Okay, a friend didn't pick up my phone. No one loves me. Why am I alive? It could be something as simple as that.
Right.
Okay,
Right.
and I'm not making it does seem like a little alien, but the thing is that they might do self-harm attempts impulsively.
Right.
Okay,
Right.
and that becomes a risk factor.
Yeah.
Because you never know when one of them might work.
Right.
Okay,
Right.
right? But let's say alcohol is a huge risk factor in terms of completed suicide. Okay, so let's say I'm very, very depressed. If I consume alcohol, because my judgment is low, I might act out. I might actually kill myself. So substance use and depression together is a very lethal combination, which is why I keep mentioning substance use. Because a lot of people don't see that as a psychiatric ailment. They see that as a self-control problem. Okay, so, right? The third thing is, of course, depression. Most people who commit suicide are more likely to be depressed. Okay, and then of course we cannot understate the importance of social factors at that time. So
Right.
like let's say in this current situation when like there is so much uncertainty, if I'm pessimistic on top of that, it
Right.
makes things even worse. So
Right.
of course, and if there's a family history again of suicide, there you go. So it's like multiple risk factors. It's not as simple as
Right.
suicide becomes a symptom of several psychiatric ailments. That's how one can see it.
Okay.
Right?
And I'm just going to connect the dots because I want to move towards resilience. And one thing you said was that the negative feelings and all of that. Building resilience is not something that you see it's not been easy. And especially I've been dealing with a lot of the millennials and adolescents.
Yeah.
They've been told a lot of things are going to be easy in their life, and they've not had it the hard way. Right? So when they face the reality of life, because you've got everything today in an instance, right? I mean, you have everything on an app, you have everything in your technology, you have everything that you can get, you have money, you can buy so many things, and really that they don't think it's going to be the hard reality hits. Now, let's say a lot of our audience today are going to be graduating, they're going to be looking for jobs in the future, and this is a very anxious situation because the global unemployment rate is very high, people and things like that. So I mean, how do I develop resilience? Or first of all, let's doctor,
let's define resilience first. Okay.
And then how do I build resilience and make myself feel like, okay, this too shall pass? How do we get there?
Right. So, this too shall pass is a very nice way of like saying resilience in a simple line. Okay. But like, let's say if I get it if I get a little like definition in this, okay, it's basically your ability to withstand adversity. Okay, that's the first part of it. Okay, in a way that is adaptive and flexible, and in the long run, regenerating. Okay, so the thing is, we can imagine like this resilience as like, let's say an R factor, let's call it an R factor, as a normal curve, okay, in the population. There are some people who, when they face adversity, get like really, really overwhelmed with it, and their performance dips. Okay, they're not able to cope. So performance, like let's talk about mental health, professional abilities, anything. Okay, it dips in the face of adversity. There are some people, when they face adversity, can rally resources and get past it. Okay, and with maybe like momentary sadness, momentary anxiety, like we were discussing about work. There are some people who, in the face of adversity, come out stronger. Okay, so they use that absolute like miserable human condition to actually to springboard and say, okay, I'm just going to get better. Like, this is not going to get the best of me. And they use that to develop permanent coping abilities. So just as an interesting thing, okay, resilience was something that started being studied in people who have had PTSD actually. Okay, so they saw like entire populations of people who were perhaps exposed to the same risk factor. So like, let's say military personnel. Or children from disadvantaged neighborhoods, who didn't have parents, who had a lot of physical abuse. So a lot of the foster care children in the American systems. And they saw how come some of them decompensate so much and become depressed or become substance abuse patients. And how do some of them just like, kind of like a lotus, just bloom in this. And they started understanding what are the characteristic factors that differentiate the two. Okay, and the interesting thing about resilience studies is this is not like, the standard when we were talking about why people don't want to go to psychiatrists is like they view themselves as weak. Okay, so if I don't have resilience, am I just weak? Like, am I just ever going to be able to deal with anything? But resilience then becomes something that you can build. Okay, it's a muscle you can flex, and which is why this is such an exciting thing for psychiatry, because for once, we can move from early detection, which is what we were talking about, early detection and treatment, to prevention. Right? So, which is why resilience is something that's so interesting. Right?
And I mean, more towards these people who are going to be, future professionals and all of that. Who would meet an adolescent who comes and tells you, doctor, I'm feeling very anxious about what the future is going to be looking like because of the current scenario. What would be a couple of things that you would ask them to do right now in terms of how to cope with the situation? Mentally, of course. I mean, physically, we build the resilience. We know there's going to be some kind of a support system eventually. But how are we going to cope with this kind of an anxious situation? Am I going to get a job? Am I going to if my exams are not over? And things like that. Where
just the uncertainty.
So if you were to meet an adolescent like that, which is predominantly our audience today, I would like you to tell me, I would request you to tell me about what would be your advice to these youngsters who are now going to be facing the world?
Right. So in other words, what I'm going to talk about is how do we build resilience? Okay. How do we deal with, I mean, of course, this one has been like a full like sledgehammer for the whole world, what we're going through right now. We can't talk about resilience right now without talking about our current crisis, right? But if you see, Immanuel, for people around our age group and maybe the ones that are even older, we've been through like these kind of things, right? There was like the dot-com bust in the early 2000s. Some of the people who are in their 50s right now have been through a couple of wars. Okay, like at least the Indo-Pak war. We've been through another recession in 2008. Okay, so we have so we know that the first thing is acceptance. Okay, and this is something I tell a lot of my patients. We think when we're building, right, that life is just going to go up like this. This is the slope. Okay, we just go up. Some people want the slope to be steeper. Some are happier with a gentler slope. But we're basically saying it has to go upwards. Okay, and the acceptance is it's like this. It's undulating. Okay, it's gonna be up, and sometimes you're staring at the top of a roller coaster and staring at like this whole ride down. And it's about how do you enjoy the ride down. Okay, so that is what. So acceptance becomes a very important part about resilience, because if you accept what you can and cannot control, okay, that's when you can look at it. This is the second thing in resilience, is to look at things in a more problem-solving manner. Okay, so it's not saying that okay, just accept it and sit tight, wait till the crisis blows over. No, it's like okay, there are parts of this which are within my control. In fact, people who feel like the locus, I'm using a technical word. Hold on. So the people who think that they can control things or things are within my control sometimes can be more adaptive. Okay? Not when you get controlling and you want everyone to do things your way, but when you think that I am the navigator of my ship. Okay? That's what I mean. And these are the things that I can control. These are the things I cannot. So within the things I can control, how can I solve the current problems? So like, let's say if someone is not going to get a job now because no one's hiring, okay, how do I use this time? How do I see this? So that means that, okay, my resume is not going to look good, but anyone will understand in the whole wide, like long-term view of this. If you didn't have a job in 2020 and 2021, everyone will know why that was. You don't have to explain that hole in your resume.
Absolutely.
Okay. So that's something that you can control, that you don't have to explain this hole in your resume. Okay. Then now that no one is hiring, was there any skill that I really wanted to learn? Was there any upskilling process that I wanted to do? Is there anything that I can bring on board in my personality, in my skills, in my certification? That would help me when people eventually start hiring.
Okay. All right.
Okay. Right. So I call this like the big resetter, right? It's basically, we would all just have gone on running like lab rats and like this loop circle. I need to study. I need to get a job. I need to do this. But this allows you to sit back and view, what did I really want in life? Okay. And how do I get closer to achieving it? So acceptance, problem solving. Okay. Right. Again, the ability to look at what you have achieved so far. Okay. All right. So to look at the fact that not everything is bleak and not everything is just bad. I have dealt with bad situations in my life before.
Okay.
And I've come out of it.
Okay.
And how do I come out of this? Also, taking responsibility for whatever has landed you there. So it's not like, oh, everything is good, pat myself, I've done really well. No, if you haven't done well, how do I get better? Okay.
And I think parenting is a very important thing over here, isn't it, Doctor?
Yes.
I mean, I feel that a lot of people, I mean, they're told that they tell the children that life's going to be very beautiful and that, and then when you get in the world, you know that it's not.
It's not fair. The number of my patients saying that's not fair. I was like, why do you think the world's going to be fair? It's not fair. You know,
you get into this whole work scenario. Wherever you're working, there's so much. It's a very competitive world out there, and people are not going to be nice with you all the time. And there are situations which are not going to be all right. And how does this play a role? How does parenting play a role in equipping our thought processes that way? And if our parents have always told us that it's going to be easy, they've made it easier for us all the life, and now we find it something very difficult. How do young adults cope with something like that?
Right. So the thing is, parenting is, of course, extremely important, right? In your mental health and how you cope with things. Right. And Indian parenting can vary, as like in any world, right? Like some of us have very strict parents. A lot of, and this is the thing is, luckily, because I do virtual sessions, I get like a lot of people with a common Asian upbringing, where you should be perfect, you should make mistakes, you should work really, really hard. Hard work is the most important thing. The ant and grasshopper story. If you work hard, things will come to you. And people expect, just because I worked hard, I should get results. And then you're like, oh wait, that isn't really true. So it's kind of like that. Okay. So but what I try to tell everyone who comes to me, right, is our parents did the best they could given the knowledge they had at that time. Okay. And with each individual generation, they are trying to fulfill the deficits of the parenting that they received. Okay. Yeah. Right? So to understand that, one, they are not superhuman. Two, they are not perfect. Three, they can make mistakes. Four, they can be wrong. And that's okay. We don't have to reject them for being that. Okay? But the thing is, now we have to move fast. We can't use that as our crutch for, I had strict parents, I'm jammed. I had parents who did everything for me. I'm never going to be able to learn to do anything myself. Right. So in a really quick nutshell, like the thing I tell my patients is this thing called a deficit. All of us are flawed. All of us have deficits. Absolutely. Okay. If I just label myself with that deficit and say, you know what, I'm fat. You know what, I'm lazy. You know what, I'm ugly. You know what, I'm unlovable. You know what, I'm gonna be alone forever. You know what, I'm incompetent. We can't do anything about it. Okay. But if I say, okay, if I'm incompetent, what are the things I'm incompetent in? Okay, so a more balanced perspective. So in my parenting, this was the deficits. That is what has made me incompetent. Okay, these are the deficits that I have. All right, and then you figure out, okay, is this a deficit that I want to fix? All right, if I'm incompetent, but the area of incompetence doesn't matter. Okay. Right? So like, let's say if I am a race car driver, but my incompetence is like, let's say perhaps in geography. Okay. I'll be like, I don't care. I understand like mechanics. I understand like maths. I can calculate things. Okay. So there are some deficits that we want to fix. There are some deficits that we want to fix because they're interfering with where we want to get in our life. Okay, so if you look at it in a problem-solving perspective, you can get better. Okay, and there are some deficits that be like, okay, you know what? I don't care. I don't care about this. I don't want to fix it. It doesn't matter in my life. I always give the example of my teeth, and how like I can look in the mirror and be like, I have the most crooked teeth in the world. But unless I want to be a model, it doesn't matter. Okay, no one cares. All right, that I have. So it's like that. And that's what allows us, we get so preoccupied with our flaws, that we're unable to get past it. So this ability to see our strengths as well as our flaws, and then try to fix our flaws if it's relevant. So the same thing in the world, right? That's what allows acceptance, right? So if it is that, like let's say in the world, okay, that there is favoritism, okay? A lot of us know that there are certain people who are just not going to get promoted. There are some people who are just not going to get jobs because you don't, like in India, a lot of it is based on your connections. Who did you know? You're not going to get your first job without you knowing someone there.
In the Arab world, we call the word, we use the word vasta here. So it's like, who do you know?
Who do you know, right? And vasta is actually a Hindi word as well, right?
Yeah,
think about it, right? It must be having like Urdu origins or
Arabic borrows a lot of words from Persian language.
Okay, yeah, right.
So we use the same word. For example, the words we use is damagh kharab. So it's not the right thing to say, but we say that in Hindi as well. So it's something we do. Yeah.
So the thing is, if you just rile against it and get frustrated about it, there's nothing you can do then. But if I find a workaround, if I can be like, okay, can I start developing networks, which is something that's very important for resilience, the ability to ask for help, the ability to set up social support systems is so important. Even when we were talking about suicide prevention, right?
Right.
To know that I am not coping, I'm drowning.
Right.
Okay, I need to ask for help.
Right.
Okay, that is something that is so important. It doesn't make you seem weak. It doesn't
Exactly.
make
I think
ask
that's
for
the whole
help.
thing. Asking for help in itself makes people feel like, okay, I'm weak, I'm incompetent, I'm incapable. That's how I'm going to be tagged. And in fact, I don't want to touch upon it right now, but I think we should do a session on self-esteem and how you've been told. You mentioned about I'm not good enough, or my teeth are not good, or if I'm not in that realm of work, then I don't really need to be worried about it. We should do something on that in the future.
Right.
Dr. We're kind of closing in on.
Yeah.
We're going to be having a conversation.
Just three things just to touch upon. I know that Immanuel is going to share certain links that will make you understand resilience in the long run.
Yes.
But just understanding because people are asking about meditation and things like that.
Yes, I wanted to touch those questions after we finish.
Okay.
So, I mean, sorry, if I'll allow you to finish, and then I want to touch upon these questions that are coming in, and then we'll open up the floor for the next 20 minutes.
Okay. Right. So just if I could just very briefly just talk about just some of the characteristics that are important for resilience, just in a nutshell, and then we can just get into answering. I won't elaborate about them.
Please.
Okay. But just basically the ability to regulate your emotions and be aware of them, the ability to face your fear, okay, the ability to use adaptive coping strategies. That means not like going and smoking a cigarette, but things that help you, okay, solve problems, okay, the ability to replace negative thoughts with positive ones, okay. Physical exercise is something that is crucial to the development of resilience. Altruism and this ability to realize that you are one in a community of people and your life has purpose in the long run, even if it doesn't have purpose now. And the sense of mastery and competence. Okay, so purpose is something that's very, very important for resilience as well. So these are just in a nutshell. Of course, we can share details later.
Right. No, I mean, I'm going to share the tools that that we've been discussing about, propose this session that we want. Now, one of the things that people asked about was that there are at least 3 people who mentioned about insomnia as a disorder. Would you want to share your thoughts about how we cope with insomnia? I mean, I find myself difficult to sleep many times, but that's stress related too.
Right. So
what are the other factors?
Yes. So insomnia, it's kind of like fever. Okay. Think of insomnia as fever. It's a symptom that, okay, a fever can just happen like that, unexplained, but it's usually a part of something that's going wrong.
Right.
Okay. So insomnia is usually a symptom of some psychiatric ailment if it continues for a long time.
Okay.
All right. But insomnia has also become part of our lifestyle. So our use of stimulants, of course, a lot of people have coffee in the evenings. There are people, I remember when all these baristas and all were opening up, people used to think it was cool to go for coffee at 9 p.m. at night. And then, of course, you can't sleep. The invasion of light into a house, okay, by the use of tube lights, by the use of screens. Insomnia has become such a staple because of screens. All of us think that our way of relaxing is watch something, Netflix and chill. Okay? But the screen is artificial. It's not allowing your body to follow its normal diurnal rhythm. So if you're watching something right before going to sleep, you're going to not be able to sleep. Okay? So if you must watch something, at least go into night mode. At least don't watch a video. Okay? If you must watch a video, watch it at least 2 hours before you have to sleep. So there is something that if people want to read up more about this, there's this concept called sleep hygiene. There are a lot of tools available for sleep hygiene. But if after following the sleep hygiene methods, you're unable to sleep, then it's best to seek help, because sleep is also one of the pathways to developing mental health disorders. If you're not sleeping well, you are more likely then to develop depression, anxiety.
Right. I mean, it's very obvious, right? When you don't sleep well, you're irritated in the mornings. You think coffee is going on the whole day and all of that. But the other thing that I wanted to talk about is physical exercise, and I think it plays a very important role in our mental, stability and helping us to keep positive. What do you think is the role of exercise in our physical?
So there are studies and studies, and this is what I tell in every single webinar I do. I was like, even if you don't take anything away from this, please take exercise. Okay, exercise is the one thing that has universally, without any doubt, been shown to be beneficial. Like, you know how certain medicines, they'll be like, oh, it's good this year, 5 years later, they're like, no, it causes cancer. Exercise is something that has universally been told to be good, and it doesn't have to be rigorous. It doesn't have to be 2 hours in the gym. Okay, the changes that exercise does is it modulates your stress pathway. It allows your brain to regenerate. It causes neurogenesis. Neurogenesis meaning building new neurons. Okay, and of course, everyone talks about exercise and endorphins. So how much exercise do you really need? Not more than 150 minutes in a week. You don't need more than that. That's like less than 2.5 hours in the whole week. That's how much exercise you need to be mentally healthy.
Right.
Okay.
They find it so lazy, right? I mean, I find myself out of the bed and having to go. Yeah.
So we tend to be in this very like, if I don't do this particular set of exercise, it's not exercise. No, just go for a walk. Okay. Like someone was asking about yoga and meditation. All right. Yoga and meditation can be physical exercise, but it does something that is even more important, which is something called mindfulness. Being aware of what you are doing, being aware of your breath, being aware of your feelings, being aware of what your body cannot do. Mindfulness is very important for resilience, but I'll cut that short. For physical exercise, even if it's just a walk, we're not talking about physical exercise to get thin. I'm not talking about physical exercise to get a six-pack ab. I'm just talking about physical exercise so that you are mentally healthy. And that you don't need more than a 20-minute walk in a day. That's all you need.
Okay. All right. The thing is, one of the questions were that how do you find the right professional to help? Because I have been to people before myself. I have been with psychologists, I've been with counselors, I've been with psychiatrists, and I have found it very difficult to get the right person who's non-judgmental. I mean, and would not incline towards general opinions and things like that. Say what is very relevant to you, suitable to you. And I think you're one of the people who stand out that way, and that's exactly why we've connected for the last couple of years. So how do we choose the right person for help, doctor? How do we know who's a good psychiatrist, who's not? I mean, good is subjective, but you know which person to consult in the right time.
I think it depends on the disorder that you have. Okay, so if you have a severe mental health disorder, by that I mean severe depression, panic attacks, you're having schizophrenia, alcohol dependence. Okay, this is the time where you want to go to a psychiatrist. Because you will need someone who understands, or bipolar disorder, right? You need someone who understands the biological underpinnings of it, okay? And then it depends on your ability to wait, okay? Psychiatric medication is completely well known for being very slow to act, okay? It takes 2 weeks before it even starts acting, okay? So there are some people who would not want to wait. Or there are some family members who find it very difficult to tolerate like someone who's just running around shouting or being aggressive. Okay. So then you need a psychiatrist who's perhaps someone who is all right with prescribing several medication at one go. Okay. So it really depends on your need. It depends on your condition at that time. But let's say you're in a moderate to mild thing. Okay. And you might be like, I need someone who's open to medication but is not going to push it. Then you go for someone like that. And let's say you're like, okay, I'm generally okay, I just want to tweak my life so I'm better. Then you might want to approach a psychologist.
But many times when we improve, when we go to a psychiatrist, the first thing they say is about or if in the very first sessions they talk about medication, and they think that's going to be the right thing. One, is that the right approach? Two, why do we still have a taboo about taking medicines for mental health? Because this is going to come back probably.
The stigma again.
I was myself apprehensive when I wanted to take medication many times. And I mean, I'm not today. I've probably reached a point where I'm not really very embarrassed to talk about it. But the time when I thought it was, because although I'm acquainted with psychological disorders right from a very young age, for myself, I've seen people around, I've seen my parents, I've seen a lot of things. And today, when I get more awareness about it, I think medication should do its duty. So how do we convince people to either go and meet a person for help, or is medication?
Yes. And I can already see the minute I said medication goes, are they addictive? That is the first thing, okay? They've got a bad rep, okay? Because the thing is, as you understand, psychiatric disorders are an umbrella. So when I say depression, okay, so many of my patients reached out to me because they were very disturbed because of the recent news saying that I'm also depressed. This person was also depressed. What if something like this happens to me? But depression is several disorders. You have mild depression, you have neurogenic depression, you have biological depression, you have moderate depression, you have severe depression, you have severe depression with psychotic symptoms. Okay, so they're not all the same. So you have to understand that when you go from moderate depression upwards, when it starts affecting your daily functioning, okay, medicine is perhaps the better way to go because it gets you better faster. Okay. The reason they have got a bad rep is because of certain medication practices. Like in America, what they call anti-anxiety medicines. In India, we call it sleeping pills. Okay. And they give it like what like I don't know how many Indians are there, but they give it like chana moongfali over there. Okay. Some people overdose on it, which is why they get a bad rep. And they are addictive. Okay. Sleeping pills are addictive. But not all psychiatric medication are addictive. So the analogy I give all my patients is it's like taking a crocin for malaria. Okay, taking a sleeping pill. It is not going to make the malaria go away. It's just going to bring your fever down. You take antibiotics, right? You take anti-parasites. That's what makes it go down. So most psychiatric medication are curative. The other reason they get a bad rep is because, please understand, we're fixing neurotransmitters that take months and months to correct levels. So when you commit to taking curative psychiatric medicine, you have to commit to about a year. So people think just because you're taking medicines for so long, the relatives are like, how long do you have to take medicines? Why aren't you going off it? You're better now. You're addicted to it. Okay. That's the other reason. You have to take it for a year. That's the reason why they get a bad rep. Okay. But you have to understand, if you find someone who's prescribing judicially, so that means, to answer your question, you have a good doctor because one, they will explain to you the medicine. They will talk to you about the side effects you're having. They'll be open to negotiating. Like, let's say you'll be like, you know what? I'm taking the medicines, but I'm feeling very sleepy. I'm not able to go to work. The medicines are to help you function. They shouldn't be taking away from your functions. Right? So if you can find someone who is able to negotiate this with you, okay, who's not making you so over medicated that you feel like a zombie, then you know you're on the right one. You're not supposed to feel like a zombie. Okay.
Touching upon addiction, doctor, how do we differentiate between medicines that are addictive and non-addictive? How do we know we are dependent on medicine or codependent on something?
So it's the same as the same thing that I spoke to you about dependence. Like, so if you see most antidepressants, you're not going to be like, when am I going to take my next antidepressant? It gives you no kick. You're not waking up in the morning saying, damn, time for me to take my medicine, right? You don't have that. Some of them develop withdrawal because they have a shorter, but then you don't have the craving. You don't have the taking over the rest of your life, right? So usually the short-acting medicines, right? So your sleeping pills are the ones that are, like, let's say, the ones that are addictive. The other ones are not.
A lot of questions on meditation and all of that. How do you a spiritual growth or meditation or a yoga, or, I mean, we spoke about physical exercise, but another stream of exercising such as yoga and meditation.
Yes.
How do they play an important role in our mental health, doctor?
Right. So okay. So just really quickly, because lots of people were asking what time is the right time to exercise. Just remember, if you're doing anything that is very physically vigorous, it will stimulate your brain as well. So you want to do them in the morning. Okay. So you're gymming, you're running, you're like HIIT, like your high intensity interval training. You wouldn't want to do them post like 8 p.m. at night. Okay. But the ones that are more like meditative, that means that like going for a walk, you don't have to really think about it. Like you can do that even later at time. Okay. All right. The other thing, okay, is this: why is yoga becoming such a buzzword? Now you have to understand the same thing doesn't fit everyone. Okay. So if you're severely depressed, yoga is not going to do nothing. It's not going to do anything. Okay. But just for general health and for mild depression, it fosters something that we call mindfulness. Okay. If you see in yoga, it's about being aware of what your body is doing at that time. So when you're breathing, it's awareness of your breathing. If you're doing an asana, it's awareness of your asana. And in fact, you can bring in that meditation to any practice that you do. If you're someone who paints, you can do it meditatively. We become we should be multitaskers. We should be doing 10 things at a time. So I'm watching a show, plus I'm like on that exercise bike. Okay. That is not going to help. Okay. But if you're on that, if you're running and you're being aware of what your body is doing when you're running.
Right.
Okay. That is bringing that mindfulness into any exercise. But if you find that difficult to do that, then yoga is a good practice. But please understand, it is not for severe mental health disorders. For that, please go to a psychiatrist. Because I've had patients who are severely depressed, whose family members will tell them, do yoga, you'll get better. You won't. You won't be able to focus. Okay? Right. You will not be able to focus.
Right. Yeah. There's another question about side effects on medication.
Yes.
Would that be too technical to answer, or is there a way you can...
No. So again, understand that for any medicine, even if it's a crocin, okay, the thing that you have to keep in mind is a risk and benefit analysis. Okay, there are certain disorders where the risk of not taking the medicine is higher than the risk of taking it. No medicine is perfect. Okay, and for certain severe disorders, the side effects are really horrible. Like if you see for schizophrenia, a lot of the medicines cause immense amount of weight gain. They cause metabolic syndromes. But the risk of not taking the medicine, meaning this person will not be functional, will be hallucinating, will be thinking people are trying to come and kill them. It is not an okay place to be.
Be in,
Okay. So it is the risk benefit analysis, which is why, again, when my patients come to me with mild depression, I'll be like, you decide. If you don't want to take medication, I understand. But if you come to me for moderate and severe, the risk of not taking the medicine overtakes the risk of taking it.
Right.
And understand that, media and common, like everyday conversations, they put all psychiatric medicine in one umbrella.
One umbrella.
Okay. And psychiatric science has, perhaps it's not as good as cancer research or something of that sort.
Right.
But why do we take anti-cancer medicines despite the risk? Our hair will fall out, our eyebrows will fall out. We won't be able to move for 3 days.
Right.
It's the same thing. It's risk-benefit analysis.
Right. I think that's a perfect analogy. Even I hadn't thought about something that way, but I think it's great. The other question is eating habits. Some of them are asking how habits do they play a role in our mental health?
Yes. So the simple thing is a balanced diet is a good diet. Okay. If you're eating junk, all right, your physical health will suffer, your mental health will suffer. Okay, if you're having adequate amounts of vegetables, adequate amount of proteins, there's no fancy science to this.
Right.
Okay. The only thing is, if you're severely depressed, I wouldn't be doing things like intermittent fasting. Okay, I wouldn't want to rock the boat. Okay. So basically, a balanced diet is a good diet. There are certain things that certain food groups that are considered good for your mental health, which is specifically omega fatty acids. Okay, so these are things that are seen in your walnuts, in your fish oils, in your seeds. These have a protective effect on your brain.
Right.
And they're considered good for your brain. So if you want to add things for positive health, this has become a buzzword. They're basically an antioxidant rich foods because that modulates your stress pathways.
Okay.
So.
Right. And there's one question I'd like to pick up. I mean, there's 2-3 people who said about cardiac arrests and mental health. I mean, is there a connection?
It's something I love talking about, especially to my older patients, because they'd be like, I don't want to take psychiatric medicines. And I'd be like, there are these wonderful studies. I think there was a landmark one perhaps in 2008 or 2010 that came out in the Lancet that says that you can reduce the risk of heart disease by 50% if you treat depression and anxiety.
Wow.
Okay. And the rehabilitation post-cardiac intervention. So if you get a bypass, you get a stent. If you treat for depression, the outcomes improve. Okay. That is how important mental health is when it comes to this. Because you understand that these are all lifestyle disorders. They are all modulated by your stress pathways. So if you control your stress, you don't get atherosclerosis. You don't get diabetes. You basically don't get your metabolism improves, your fatigability reduces, You're able to exercise.
Right.
Okay. So it basically will connect with the pathways that cause cardiac ailments, which is why it's important.
Okay. And there's another question. Do introverts have high chances to be more depressed in terms or mental disorders?
No. No. Introverts just, the thing is, as long as they have some adaptive techniques. Okay. So introvert and extrovert. Okay. Extroverts are just people who need more people.
Right.
Okay. And introverts, in fact, if you force an introvert to be an extrovert, they might in fact get stressed because they need that quiet space to regenerate.
Right.
Okay. So as long as you have some support systems, I don't have to go and meet 15 people a day. Okay. I need that 1 hour to myself to feel normal.
Right.
Okay. Introverts have a high need to be by themselves. That's what helps them regenerate. Okay. But as long as you use that time to do some adaptive things. Okay. So you exercise, you read, you draw, paint, whatever solitary activity that resets your brain. That's fine.
And there's some questions about mood swings, doctor. What
Yes.
is mood swings similar to, or is this just a common word for our irritability and emotions? What are mood swings?
Yes. So I'm very glad you come up with this because right now everyone talks about I have mood swings, I have bipolar disorder. No, that is not what bipolar disorder is. Okay. Right. But mood swings are very normal when we lack or when we are deficient in mindfulness. That means that all our negative moods, okay, in psychiatry we call it affects. So frustration, irritation, anger, sadness, dejection, rejection. We are not aware of the shades of them. Okay. And then it just piles up.
Right.
We don't do anything about it. It piles up and it explodes.
Right.
Okay. So sometimes just being aware of our moods, this whole need to be happy all the time, I blame that. Okay. It's okay to be irritated. Okay. And deal with it when it is manageable. Figure out what's irritating you. Solve that problem. Instead of letting it fester and become Mount Vesuvius. And
I think what a big takeaway is it's okay to not be okay, right? And I think that's the whole essence of trying to tell people that it's fine to not be okay, as opposed to you think you always need to be sorted. You think you always need to have the same mood and all of that. And if you're not, then there's something wrong with you. So
I think it's very important. And when you were talking about millennials and having it easy, I just want to end because I really want to talk about this. We do, I know it's a common joke among all of us that millennials have it so easy and blah. But you know what? The pressures they have are very different from the ones we had. Okay, if someone irritated us, we had the luxury of not knowing what that person is doing. Okay, I could just cut that person out of my life. Okay, now because of social media. Every single thing is broadcast into your house. The need to keep up with the Joneses is higher than ever before. And the takeaway I want you to have is that please understand that anything anyone is putting up on social media is a curated highlights reel of their life. Okay? Right? No one is going to say after putting up that picture, I went and cried in a corner for half an hour. No one is going to tell you that. Okay.
I think that's one thing we're going to have to talk about, Doctor. That comes from social media and and all of that. I mean, I think there's so much we can talk about in the future. And a lot of people are also asking about coping breakups. I don't think this is something that we can talk about in so easily. It's not a thing that we can deal with, but it's related to depression. Yes.
Doctor? 3 things. Just have gratitude.
Right.
Balance your picture out. Be aware of the negatives as well as the positives. Okay. Look at your strengths. Don't personalize.
Right. There's plenty of questions people are asking, and I think we're actually running out of time. I'm going to be putting Dr. Nikita's contact over here. Please do not call her. Please WhatsApp her and email her. She's available.
I will. If you call me up, I won't pick it up. I'll just tell you that. I won't pick it up. I don't pick up phone calls. Okay.
Right. I'm just giving it because I think she's always available. She's somebody who's put herself out there for everybody. She's on WhatsApp with me whenever I meet her. And I mean, despite a busy schedule, she's taken time out to be here with us today. She's got back-to-back schedule. So Dr. Nikita, thank you so much for your time. And I think a lot of technical questions. We also have some psychiatry students on our forum today, and I think they should be able to connect with you on a different level. So I'm going to let them connect with you over WhatsApp or email. So if you're a student of psychology or psychiatry, so please contact Dr. Nikita over her email. And that's one thing. For people, one of the craze that all of us have over here, they want certificates after the webinar. So for those of you who want certificates after webinar, you got to do two things. One is you're going to have to go on social media on my platform and give us a feedback for Dr. Nikita and myself and review. So I'm going to be putting here my Facebook link, and all of you are on my Instagram already. So you can go there, put the feedback. That's one thing we'd like to do. Once you give the feedback there, I'd like you to take a screenshot and send it to me on my email. Right? You have my email. You've got all the invites that we've sent out to you. So I'm going to be, my Instagram is the same as my Facebook. You can message me. You can find me on Facebook and Instagram. So please go leave your reviews on the Facebook page and on Instagram page. And if you want to get in touch with Dr. Nikita, you have her email address and phone number that I've given. If you want to prove your presence on our webinar, please take a screenshot of you being there on the webinar for your certificate. And like I said, if you want your certificate, you're going to have to fill up the feedback form. You're going to have to give your reviews on Facebook and on Instagram. So Dr. Nikita, any last few words before we...
Yes, I first wanted to thank you for having me here, and thank you, all of you, for on a Saturday morning, sitting and listening to me talk for an hour and a half. But more importantly, thank you for wanting to be aware of your mental health. It is something that not enough people talk about. And I'm really proud of this upcoming generation that they're so open about talking about it. They are so open. I have so many young kids who don't have any disorder, but and they are always they'd be like, I'll speak to you every week. I'll speak to you. They don't wait for things to get worse. Right. And I'm really, really so happy that our country is progressing towards talking about mental health as a really important part of their quality of life. And with just a few tweaks to your everyday life, it doesn't take too much time to have gratitude. It doesn't take too much time to think about the things that are good in your life. It doesn't take too much time to look after your body. It doesn't take too much. People forget to eat because they are working.
Right.
When did we get to a place where working has become important than eating? So think about the long run, think about sustainability, think about yourself. That is the most important thing.
Right. I mean, it's funny how you brought it up, because many times we skip meals because of work.
Yes.
We can do away. So Dr. Once again, I think I'm making everybody more reachable. Thank you for putting yourself out there, which most doctors wish to do. And I really think this is the time you've really come out to us and to talk to us. And I really wish we could have plenty more sessions. And,
yes.
and let me tell you, Dr. Nikita has been very graceful to us to come over today and her time out. I mean, there's times Nikita will not answer my call or messages because she's back-to-back patients and all of that. But Doctor, we've had a great experience having you.
Thank you so much, Immanuel. Thank you so much.
Looking forward to seeing you more sessions with us on mental health. And thank you so much once again.
Thank you so much. Thank you.
So yeah, I put out my